Hi folks, hi followers. This time I come here to make a video it's dedicated to the new followers and to the candidates, the patients, for people that still don't know well or nothing about the traditional Chinese medicine. So I'm gonna leave here 5 questions for people that suffer of urticaria. And I'm gonna put the questions, but I won't give the answers. So it's just for you to think. And you will find the answers by watching other videos of mine. And also, I will come here to answer, but not now. In the future, I will answer to all these questions. But it's just for you that you are fighting this condition. This is not a disease. This is just a symptom. So, first question, number 1. Does it make sense? Does it make sense using an immunosuppressant or immunobiological without making any autoimmunity tests? For example, without making a FAN test, which is a anti-nuclear cell factor test. It's one of the main autoimmune tests or to determine autoimmunity. Does it make sense using these immunosuppressants and immunobiologics without testing? If the person has autoimmunity positive values? I leave the question. Number 2, does it make sense to use both immunosuppressants or immunobiologicals, no matter if the autoimmune tests are positive or negative? Now, I'm not speaking about not doing it. I'm speaking about people that made the test, that did the tests. And no matter if it's the positive for autoimmunity or a negative, in conventional medicine, they say that it doesn't matter because the treatment will be the same. So what is the same is the result, which is zero results in conventional medicines, because we cannot follow the same way if we have an autoimmune condition or if the person doesn't have autoimmunity. So I'm not going to answer also. Number 3, traditional Chinese medicine always affirmed that, and it's a basic rule, that acute urticarias, they are allergies, but not chronic urticarias. Chronic urticarias, they are not allergies. They are symptoms, they are the result of imbalances that are installed on the internal organs. So on the last years, the conventional medicine started to get closer and closer to this basic rule of the traditional Chinese medicine. So they made a new conclusion. So if it's not an allergy, that means that the patient can eat or drink everything he or she wants, because it's not an allergic problem. It's not an allergic situation. So what I ask is it the same drinking water or drinking whiskey for the body, for example, for the liver? Is it the same drinking water or drinking whiskey? Does the liver deal and work the same way or make the same effort to deal with water with whiskey or another alcoholic drink? I leave the question for you, but I think you already know the answer. Is it the same thing, for example, eating chicken chest or turkey chest, or eating red meat like a steak that has much more fat than chicken? Is it the same for the liver? Is it the same for the gallbladder to deal with a very fat meat or with a white meat of chicken? Is it the same for the body to deal with and processing, for example, an apple or pepper? Do you think it's wrong to think that, for example, water is cryogenic, so it creates cold, it cools, it refreshes the body, the system, and pepper, it creates heat, and it warms the system. Is it wrong to think that certain things are cryogenic, so they create cold, and the other ones are thermogenic and create heat? Like, for example, the fat and the red meat, they are thermogenic. So I leave the question also for you to think. Number 4. For example, I have cases of patients that, for example, women that lost their husbands, so they became widows. Then they develop chronic urticarias after a while. Is it normal that a doctor doesn't ask, for example, the doctor is not going to ask if the person is widow, but for example, if he asks if the person is married or something about her life, he's going to find out that she is a widow. So is it normal that none of these questions are made are put to patients? Another thing, when some doctors, when they find out, for example, that someone that has urticaria is a widow or lost the mother recently, they always advise the person, or they forward the person to a psychiatrist. Is this normal? That's every time they forward or put a psychiatrist on the equation? Do you think it's normal that a person, or all the people that got widows in this world, they need all a psychiatrist? Because I know people that they suffered a lot, but they didn't lose balance. They didn't need a psychiatrist or a shrink. So the question I leave is just because someone had sadness or a huge problem in their lives, is it mandatory going to a psychiatrist? I leave the question. Now, the 5th question, number 5. It's a basic rule for the Chinese medicine that the skin has pores, and the pores and the skin pores and opening and closing the pores, this is controlled by the lung. This is nowadays also accepted by the conventional medicine. So urticaria is considered by the conventional medicine as a skin problem. But by the Chinese medicine, there is a symptom caused by imbalances on the internal organs. So if both medicines accept that the skin pores are controlled by the internal lungs, and if the body opens the pores to release heat from the inside to outside, and if also close the pores, diminish the diameter, to stop, to prevent, to protect the body from cold and humidity invasion. Don't you think it's logical to think that we need to pay at least some attention to the internal organs? Because, for example, cholinergic urticaria is a pure example of physical urticaria that attacks, that breaks out with the heat. So if the pores don't open enough, the body accumulates heat inside. So it doesn't release heat for the outside. So isn't this adding heat to a system that already has heat in excess? And when I speak about thermogenic foods and thermogenic environments, I'm not speaking about the body temperature, not about fever. No, it's the capacity of creating heat in excess. For example, people that train on gyms, and many times they take thermogenic products to burn fat, to increase the metabolism, and their temperature on the thermometer, it's the same. So we're not speaking about body temperature, we're speaking about body heat and accelerated metabolism, which creates more heat inside. If the heat goes up, the water goes down. If the water goes down, we have histamine out of the mast cells that is also accepted by the conventional medicine. So I also leave this question. Don't you think it could be logical if, for example, the lung, and I'm just giving just one example, if the lung controls the diameter of the skin pores, isn't it logical to look at the lung instead of looking to the skin? These are the 5 questions I want to leave you for. Please think of these, Google, research, and you will find out, you'll discover amazing things about this. So hugs and kisses, follow me, and very soon I will start releasing more videos that explain the role of internal organs on a normal body, on a balanced body, but also on the body of someone that is suffering of chronic urticaria. Hugs and kisses.